So, very good evening, everyone. It gives me immense pleasure, believe me, of more than 100 episodes which we have done. I think this is going to be one of that special and I would say jovial. The moment I say, I think both of us are already started laughing about it. जिंदगी में अक्सर ऐसे होता है कि जिंदगी है तो टेंशन है और टेंशन है तो जिंदगी है. मैं यहाँ पर कोट करूंगा रतन टाटा साहब का एक कोट. He says, even in an ECG, you love the ups and downs because a flat ECG means no life. So that is how life is. Without ups and downs, there is no life. And then, how do you make it more interesting? How do you live life and how do you come out of life? So it is, I would say, सिर्फ डायबिटिक पेशेंट के लिए ही नहीं, हर पेशेंट के लिए हम इससे कैसे जूझ सकते हैं, हम इसे कैसे बेहतर बना सकते हैं. तो मैं शुरू करूंगा एक मेरे जो प्रैक्टिकल एक्सपीरियंस हुआ था. वो अक्सर सभी को सुनकर बहुत हंसी आती है. तो आई एडवाइज माई वन ऑफ माई पेशेंट. सीरियसली आई सॉ एंड देन आई टोल्ड, ओके, योर A1C इज़ वेरी बैड. आपको ग्रीन वेजिटेबल्स ज़्यादा लेना है, अंडरग्राउंड वेजिटेबल्स अवॉइड करना है. दीज आर अ सेट ऑफ थिंग्स आपको खाना है. So almost I spoke for 4-5 minutes and then when everything was done, the patient told me, डॉक्टर साहब ये सब खाने के पहले खाना है या खाने के बाद खाना है? So that is the state of I would say all of us. To talk with us, to take us through this lovely journey of live your life so that there is laughter, there is smile, there is so much more for all of us, for not only a diabetic patient, I would say for all of us. To speak on that, I have my senior colleague with me today, Dr. V.V. Ramakumar. He's a senior consultant diabetologist having an experience of more than 3 decades. He's been awarded recipient from the IDF, International Diabetes Federation. And then at 58 years of prestigious our own RSSDI conference, he was awarded with fellowship of the prestigious RSSDI at Chennai last month. So very welcome to you, sir.
Good evening. I thank RSSDA and thank you for your nice introduction. Laughter is the best medicine, I believe, because we can have laughter anywhere in the world. Wherever you go, you can have the same language, that is laughter. That is the universal language. So you can communicate with anyone with laughter. So even if I don't know, you don't know Telugu, I don't know Hindi, but we can communicate with laughter. So that is the laughter. We have so many benefits of laughter, and I thank you, RSSDA, for involving this chapter. Yeah.
Yeah. So to start with, I must say you are one of the pioneers in this laughter therapy. All of us love you, and then we love the way you do your things, the way you make people laugh, the way you treat. So to start off, can you just guide us what you have been doing through and how this is important for the diabetic patients?
Okay. For us, let me show you a book. This is a book, Advances in Diabetes, written by our senior most endocrinologist, Dr. Sridhar Garu. He is from Vishakhapatnam. So, in that, if you go and see the 15th chapter, this is about gelitology. You know, gelitology is a study of our use of diabetes, our use of laughter in human diseases. So, what they say is, if you laugh, you will get relief from some diseases and control blood sugar effectively along with your medications. So that is, we wrote together gelitology. So what gelitology means, the use of laughter in medicine along with the medicines. We should not neglect our standard medical care, but I believe that if you can laugh more, we can have definitely more blood sugar control. It all started some 10 years back when we were having our annual conference in Kuala Lumpur, that is Andhra Pradesh Diabetes Federation conference. I was asked to talk about laughter and diabetes. So then I went through that. Then I searched and I found that there is evidence that laughter is useful in treating diabetes. Because as I'm a diabetologist, I will be interested more in diabetes control. So let me tell you what happened. In Japan, there was a study where they took a group of patients and they measured their blood sugar before And after that, they showed a serious show or some stupid or some boring television serial, and they measured the blood sugar afterwards. And next day, they repeated the same with a comedy show where there is laughter. And they found out that there is a reduction of postprandial blood sugar by around 40%. That is very interesting. So how I got involved in that is this study from Japan. So this simply shows that if you laugh, you can control your blood sugar. So that's how I got interested, and I went and I did some research and found out so many things about laughter, which I will be telling you.
Yeah. So yeah, thank you for sharing that valuable insights. अक्सर ये होता है कि we always start with pressure. So the moment we get up in the morning, all of us are having timelines, all of us have deadlines, and the moment we start in the morning, I think few of us start with yoga, few of us start probably as people like me go to the gym, but I can read that nice round logo on your T-shirt which says "Laughter Yoga." So, if you can tell us something on that, and then what is important and how do the patients start their day with that?
Yeah, that's right. Okay, let us discuss a few moments about laughter. Laughter, as you know, it has so many benefits. Laughter, as you know, it immediate stress reliever. Whenever you are stressed, if you laugh or someone smiles, you will have a lot of relief from that stress. Because laughter brings out the stress hormones, and it increases the laughter hormones. So they will be very useful in reducing the stress, your stress. Then there are shorter term benefits, like it stimulates the oxygen and it gives more oxygen to the lungs and brain, and we can increase the oxygenation of these organs and activates this relieve your stress response. And it is always known that it soothes tension. And there are long-term benefits of laughter, like improving your immune system. you know this negative thoughts manifest into chemical reaction. We saw in during COVID times how people got scared and they got so many problems. So what my guru Dr. Madan Kataria says, that the only people who got who are not affected by these COVID is those people who are laughing. So, and it relieves pain. As you know, it is laughter yoga is shown to be reducing the pain in cancer patients, those who are having pain, and increases personal satisfaction. You might be having that whenever you smile with your patient and talk with them softly, and if they laugh, you will be very happy. That's how it increases the personal satisfaction and improves your mood. Suppose you are having some problem, and if someone smiles at you, it will be natural immune, that what you call mood, really mood increases. And it is always useful to learn to laugh, and laugh with your friends, laugh with your family and others. So what I did was, I like laughter, so I started one laughter club in Guntur, where we all doctors meet, doctors laughter club it is called, and we try to laugh together. Then I came to know about laughter yoga. So what is laughter yoga? Laughter yoga is, we will laugh without any reason. Means we will be laughing for no reason, because we want to get all the benefits of laughter. Laughter is beneficial. We are having so many benefits of laughter. So that's how this started. This was started in 1995 by Dr. Madan Kateria. He is a medical doctor. So what he says is that whether you laugh naturally or by some stimulation or by yourself, you will get all the benefits of laughter. What he believes is that if you can laugh for 10 to 15 minutes, then it will get all the benefits of laughter. As we are growing bigger, we are laughing less. They say that children laugh around 400 to 500 times a day. But as we grow, we are laughing less. So Dr. Madan Kataria says that if you can bring the child in us, okay, then we can laugh more and have laughter. And laughter yoga has shown many benefits, and it has shown that it will decrease the blood pressure and improves the cardiovascular problems, and it reduces the endothelial injury by giving more reduction in the oxidative stress. And it is also shown that it can reduce the complications of the diabetes by reducing the prorenin in the body. So many benefits were there, and stress relief, as you know, is as usual. So these laughter yoga I learned, and I'm trying to teach my patients to laugh. That's laughter yoga. So laughter yoga is basically we will start a laughter in a group and laugh together. But as you know, laughter is contagious. Once you laugh, the other person will also laugh. So it will spread the whole group. That is laughter yoga, and it has shown many benefits. And there are having so many studies where it is proved that all these problems can be reduced by laughter.
Yeah, so very well said, sir. I would definitely say each and every word resonates with all of us. And then the benefits, what you have clearly mentioned during the period, I think, of COVID, all of us were so tense. I think you rightly mentioned people who were, I would say, bindas, who lived, जो होगा देखा जाएगा, we will follow the protocols, but we will live our life. हम हंसेंगे, हम दुख नहीं होंगे. I think most of us came through that, and that is how I think as doctors we've been doing that since the day one we practiced. Because I still remember my UG day when I did my first internship in a government medical college. So we had so many deaths on that first day. I had not seen a death since ages. And then in a one day, I had seen 7, 8 people dying in front of me for various reasons. So I was so depressed myself. So I think that is where we all realized that if we have to keep on going, I think that is the only answer. सो सर अब ये बताइए कि हमने डिस्कस किया, डेफिनेटली मूड एलिवेटर है, दूसरों का भी मूड इम्प्रूव करता है, कैंसर थेरेपी में भी ये काफ़ी इसके बेनिफिट्स डेफिनेटली आए हैं. लाफ्टर से एंडोर्फिन्स रिलीज होते हैं, डोपामिन जो कि मूड एलिवेटर है, दैट हेल्प्स. सो आपने ये बताया कि इसके क्लासेस होते हैं. अगर इफ़ यू वांट टू सजेस्ट इट टू सम पेशेंट्स as a routine, say 5 minutes, 10 minutes. So, how do they do that, and how frequently they do that in a week?
Yeah, actually, there are no contra indications or dosage things for laughter, because laughter is easily available everywhere. And what I feel is it is underused and understated laughter. So laughter can be used. Suppose if you are practicing, we wrote an article about laughter therapy in diabetes, and where Dr. Sanjay Karla, me, and Ram Mohan, we wrote together. And what we say that if you can laugh with your patient, okay, then you will have better relation with the patient. They say no, you might have traveled many times. Those people who smile at you, you will like them. You when you go for a hotel, they say that if I there are some jokes about if our that person in the reception doesn't laugh, we will give you back the money, something like that. So laughter is most important. What I feel is if you can laugh more in the life, then you will have better. So what I suggest my patients is, even if you do laughter yoga or not do laughter yoga, but try to laugh more whenever you have a chance. Okay, that will be useful. So I will demonstrate you what to do in laughter yoga. Okay, but before that you try to laugh together. And I did some course in happiness, how to be happy, right? So what they suggest is, if you are laughing more, you will be happy. And another thing is, if you want to be happy, you laugh for the jokes whatever your friend says or whatever your family member says, because this will improve your satisfaction and his satisfaction. So the best way to learn for laughing more is tell some jokes or to be happy, to be laughing more whenever there is a chance. And don't deny the chance if you have a chance to laugh. Most of us will do is, why should I laugh? Why should I laugh? So, but you take more chances to laugh, and world will be different. As you know, laughter is the best medicine. What we believe. So, I will show you laughter yoga at the end. If you have some more questions, which we can do practically every day. Okay. But before that, let us have some more discussion.
Yeah. So now my next question would be, since we have a general audience here, and then I definitely believe for diabetic patients, for hypertension patients, for patients with coronary artery disease,
Yeah,
we've
yes,
talked
yes.
about cancer. So is it that we make a routine habit for all of us with our entire family, with the kids? So can we involve the kids as well? So with the amount of stress what they have, so can we do it as a family therapy? Maybe 10 minutes or 15 minutes, any part of the day, where the entire family sits together and does some
Yes.
kind of therapy. What will be your idea on that?
Yeah. It's a good idea to, when you go home, they say that when you want to be happy, you see your family members as though you met them after so many years. Then it will be good. And smile with them. And smile definitely improves. Suppose my daughter is there, she may say some jokes, you laugh with her. I once asked her, I want to make people laugh with my dance. What should I? What song should I? She said, "Don't worry, Daddy. You go and dance. Everyone will laugh." So it's like you should develop sense of humor, right? And another thing is, I got one prize in stand-up comedy, and I went and told my wife I got stand-up comedy first prize. Oh, she asked me simply, "Oh, no one else was participating, I think." So like that, we have to laugh more with your people and the family. And I will tell you what you should do with your family in laughter yoga also. But what I found out is, if you can laugh with your patients, tell them some nice jokes, but these jokes should not be hurting them or something like that, then it will be useful. We have to go to their level and tell the jokes. I get patients from the rural areas. I tell them jokes which are suitable to them. We can't tell them some technical jokes, but laughter does benefits. So I will tell them some joke, like I had a patient whom I teach them everything about diabetes, how to control your diet, everything. And he said, for exercise, he will go for cycling. Oh, that's good, because in my area, many people are going for cycling. I said, okay, go for cycling. He came back after 2 or 3 months. His diabetes not under control, and he put on weight. Then I asked him, "Are you following my diet?" He said, "Yes." Then, "Are you doing exercise?" "Yes, I'm going for cycling." "Oh, you going for cycling?" He said he will go for cycling because his friend is there, and both of them go together. So then I asked him, "Then why did you put on weight even though you went for cycling?" He said, "I'm going with my friend every day and I'm not losing weight." Then I asked him, "What about your friend? Did he lose weight?" "Yeah, he lost so many kgs." Then I asked him, "How it happened?" "I don't know. He is riding the bicycle, I'm sitting behind him." So he's just simply sitting behind him and not riding the bicycle. So people believe that, like that, we have to educate the patients. And if you tell them some jokes, like what you said earlier, after telling everything diet, they will ask, "What should I eat? What should I not eat?" So these are the jokes which we can make with the patients and make them laugh, and it will be more. And I had a patient like your patient. I told her, explained everything, and she went off home and came back, but she gained weight. Then I asked her, "Why did you did you practice all my sayings?" She said, "Yes." Then I asked her, "What about diet?" She's saying, "I'm taking 3 pulkas immediately after rice," because she doesn't know that she has to substitute the pulkas with the rice. So she's taking pulkas and again rice. Okay. Then I told her, "You can't do that. You shouldn't take pulkas after rice." She said, "Oh, should I take it before?" So like that, they don't understand. So we have to have some jokes with them. And I tell them, my patients also, a joke about sunflower. Once they brought a patient to clinic. His complaint is his head is rotating east in the morning, west in the evening, and in the afternoon it is going up. Then this doctor simply said, "Don't worry, you stop, reduce your sunflower oil," because most of our patients think they're it's good to eat more sunflower oil because they think it's to the advertisement. So this fellow is eating so much sunflower oil, so his head is rotating like a sunflower. So these are the jokes which you can tell them and make them funny. So definitely laughter makes your life better and patient's life, and you will have more satisfaction when you make your patients to laugh. Both it will be beneficial for you and to the patient. So you will be reducing stress, and patient will also have beneficial effects. Okay.
Yeah. I definitely so much correlate myself when you're talking about this. I think all of us would be correlating on a routine day-to-day basis. I think most of our patients come to us with something like this, and then it is always. I think it depends on us, as you rightly said. We can react in the way. There are two ways: either we be stubborn and then give them back to what are you doing, this is and that, or we take it in a lighter way and then we get tell them in their way so that it is well taken, the message is gone clearly, and then they also get a little relief. And then I'm sure, be patient, be anywhere, whenever, as you rightly said, if we are going somewhere, if we see a smile that is contagious, that is bound to spread. You just cannot stop yourself from smiling if somebody else is doing it. So definitely, I totally resonate with you, and then I totally agree with your thoughts. And I think from today, all of us should make this a habit when we go back. I think I was just doing some loud thinking in my mind that when we go back in the night, I think that is where we are most stressed. So with the families, I think 15 to 20 minutes, if not more, we can do all this. It's a good, I would say, family bonding therapy as well, so that we sit with the families, and then this can be implied to all the patients as well. So as you rightly said, this can be passed on to the patient, that along with your physical activity, yes, you do. We say so much about diet, we say so much about physical activity, walking, but as you rightly said, I think it is time that we tell them, we prescribe them laughter. Because as I again correlate, यू सेड दैट हम सब में बचपना नहीं है। हम जब बड़े हो जा रहे हैं तो हमारे अंदर का बच्चा, हमारे अंदर का वो बचपना कहीं ना कहीं खो गया है। उसे ढूंढ के लाना है, उसे फिर से लाना है। तो आई थिंक it is time that we all start prescribing laughter therapy. I'm gonna sure the moment we tell this, the patient is gonna start laughing. You prescribing me laughter therapy. So even I am not sure how they're going to take it, but I take a leaf from your book, and I think I would start doing it, and maybe next time when we meet, I'll tell you more on that. So to continue it more forward, now I think if you can show us some
Yes,
that
yes.
laughter
Laughter
yoga,
yoga.
some practical things which will be beneficial for the patients.
Thank you. Let us. There are four steps in laughter yoga. What we will do is, clapping. Clapping is good for bringing your mood into laughter. So, but you should clap with me, okay? Don't hesitate. And another thing is, it is it looks a bit abnormal to laugh, but once you give up all these factors which you think about judgment, oh, someone may be judging if I laugh. So if you remove all these, you can laugh well. It is a bit inconvenient to laugh in the beginning, but once you start laughing, you can't stop laughing. Okay, first step in laughter yoga is clapping. You clap with me. Ha ha ho ho. Ha ha
Uh-huh.
ho ho.
Oh,
Ha ha ho
uh-huh.
ho.
Oh,
Ha ha ho ho.
oh,
Ha
oh,
ha ho ho.
oh,
And
oh.
laugh it up. That is the clapping. So whenever you are stressed, just clap. Then second step, what we call is, there are, laughter yoga breathing. Any exercise program or any yogic program, we need to do some breathing exercise. The breathing exercise, by nature, it increases your expiration. You inspire, but you are expiring more, so to give out the stale or air, other air from the lungs. So what laughter yoga says, that if you can expire slowly with laughter, then you will be having more oxygen to the brain. So you have to do with me. Take a deep breath,
Sure.
hold it, expire. That is normally what we'll do in any pranayama, anything. But what we'll do in laughter yoga is, you have to do with me. Take a deep breath, hold it, and laugh off while exhaling. Very good, very good. Hey, another time we will do. Take a long breath. hold it, and laugh it up. Very good, very good. Hey, another time we'll do. Take a deep breath, hold it, hold it. Very good, very good. Hey, so whenever you are tense or whenever you are having problem, go to the other room somewhere and do this. Then you will have a lot of relief because laughing will help, and at the same time your exhalation slowly will also. So what they say, whenever you are stressed, take a deep breath, right? Like that, we can deep breath and do that, and that is second one. And third one is what the people, laughter yoga people believe is that you have to bring child in your, so we have to do something funny for ourselves. So whenever you have problem, just say this, very good, very good, hey, that's how children they play.
Okay.
Very good, very good,
Very good.
hey.
Very good. Hey.
Very good,
Amazing.
very good, hey. So this will bring out a lot of stress, and you will feel more active, energetic once you laugh it out. And fourth stage in laughter yoga is we will do some laughter exercises. Means these exercises will be laugh with laughter, and you can do routine activities with this laughter. So first is Namaste laughter. You know, Dr. Madan Kataria belongs to India, so he introduced this to so many countries. Around 120 countries they do it laughter yoga. That's wonderful. So what he starts is you take Namaskar laughter. So take your hands together and see into your neighbor and laugh. And this was liked by my professor of diabetology. He said every day he's laughing with his wife with this namaskar morning. That definitely improves the, family relationship. Definitely.
Oh, yes.
Second one is called as shake hand laughter. You can shake hand with your neighbor, look into his eyes and laugh. And third important thing what they do is we should appreciate more in the life. That is lacking in the life. So there are so many nice things people do, but we don't care. Why should I appreciate him? Dr. Madan Kataria says that if you can appreciate people, your wife or your worker, anywhere, anyone, you will have better life. So try to
Yeah.
appreciate people. There are two ways in appreciation. One is Indian style. Or in American style. Thumbs up.
Yeah.
Dr. Farista, congratulations. You got RSSDA fellowship. I am appreciating that.
Thank you. Same to you.
Very good, very good. Hey, so this we should do. And another one important thing is this is useful whenever you want to argue with someone. Okay, we can argue with laughter. That is shown in psychology also. If you want to tell them someone, you if you tell with the laughter, it will be taken more than with your anger. So
Oh, yes.
nobody likes to be anger people. So what we should do is argument laughter, they call it. Your blood sugar is too high. Try to exercise and do things. Then people will like it.
Yeah.
Most of diabetics they will be very guilty once their sugar is high. So if you tell them, tell that you have to improve your exercise, diet, and other things, but with laughter. Don't get angry.
Yeah.
So you tell. Even with your spouse, if you tell like this, you will have better relation. You try it.
Yeah, but I'm not sure if we can point out the finger like this.
And there are so many of like this. And we can take a coffee whenever you want a coffee. Even if you don't have a coffee, take one cup and one tumbler and mix the coffee, and drinking, laugh it off. Very good, very good. Hey, and
Mm.
what's the time? Time is to laugh. So let us laugh. That is how we have to laugh more frequently. This is time to laugh. So laugh. Show your watch and laugh it off. And the next thing is you are laughing for no reason. We have don't know reason. When Dr. Madan Kataria and others are laughing in the park, the people used to come and ask, why are you laughing? They said, we don't know the reason. So if you can laugh for no reason, that will be good. Okay.
Yeah.
And finally, I want to show the ultimate laughter is laughing with your whole hearted. Take this. Very good, very good. Hey, very good, very good. Hey, and finally, we will do one challenge. You check your clock watch, okay, and we are laughing together for 1 minute, only 1 minute, and I want you to do with your family every day this 1 minute of laughter, and it will be very happy. So you are checking the watch.
Yeah,
Okay, let
done.
us laugh.
Be- Believe me, the minute is done,
Very good.
but believe me, I really appreciate this uh, from bottom of my heart. I think all of us enjoyed this and all of us loved this, and I'm sure this 1 minute challenge, I think we're going to start it as, probably I would also request the RSSDI team, we can start it as a challenge,
Yes.
hashtag 1 minute laughter challenge, and post it across. Let's see how does it go. But believe me, I mean, in initially 30 seconds I will say I was like, am I becoming childish? And the next 30 seconds I feel I should have done it more. So definitely I think there's a lot of learning, and then we all have to regenerate the child in us. So thank you so much for bringing out the laughter, I would say, from all of us. So before closing down, one last message from your side to all our people who are watching.
Yeah. My last message is like what you said. I gave one laughter yoga demo in the Rotary Club. They said from next week onwards, we will laugh for 1 minute, like what you said. So if you can implicate this, that will be good. Try to laugh more and have more situations to laugh and have a mind to laugh. Then you will have better world, better health, and everything will be fine. Keep laughing. Thank you very much. Namaste.
Yeah. Thank you so much
Thank
for, I would say, regenerating all of us. Thank you so much for showing us all the asanas and taking us through the benefits. And then, believe me, I'm going to put that straight away, the 1 minute challenge, and I will request it across all our RSSDI team as well. So, thank you so much for spending our time. And I would say, keep laughing, Gina Isi ka naam hai. Thank you.
Yes. Thank you.